We've been living under a state of emergency across this country for, nearly a month now, and we know that you have plenty of questions about COVID-19 and how you can stay safe. So joining us once again with all the answers is infectious diseases specialist, Dr. Bogoch. Good to see you this morning.
Good morning.
All right, so we could see between 11,000 and 22,000 deaths in Canada over the next couple of months. This is according to new federal health models. How accurate, Doctor, are these projections, and what are they based on?
These are just models. We have to be clear that this is not a crystal ball, that there's certainly some assumptions that go into these models. There may be highs, there may be lows. We might even get under that 11,000. And a lot of this really just depends on how we do doing with our physical distancing and with us adhering to the public health measures that are in place. So this is not set in stone. These are just projections that sort of outline possible scenarios.
Are they helpful, do you think?
I think they're extremely helpful because they help us prepare for worst case scenarios. They help us show how well we've been doing and where we could have been if we had not practiced physical distancing measures. And it also shows us best case scenarios too. There was other numbers that I thought were extremely useful in terms of lower deaths, lower hospitalizations, if we really have very stringent programs here in Canada that are adhered to.
Okay, next question. Can you make any dietary changes to help protect you from a severe case of COVID-19?
I think really just related to that, the best thing people can do is to ensure that they're in optimal health. And even throughout all this, I think it's extremely important to have a well-balanced diet, to get some exercise, and to ensure that you're getting enough sleep. And I really think that, those are measures that people can take into their own hands that really can help out with general health and wellness and put people in better shape than if they're, ignoring some of those three fundamental tenets.
Does an increased lung capacity help you fight viruses like COVID-19? There's our next question.
That's interesting. That's tough to say. We certainly know that this can affect the lung, and certainly if people are having severe lung infections, we know that those with greater lung capacity may have just more resiliency. But I think, how do we sort of personalize this and operationalize this? The key message here is if people are smoking, this is the time to quit. This is a wonderful opportunity. It is never too late to quit. And this is just a perfect opportunity to stop smoking if people are doing so now.
Can the virus live in your hair or your facial hair? There's a question for you.
Yeah, in general, I don't think people should be too worried about the virus living in their hair or in their facial hair. But I think it's interesting. There's sort of a side tangent to this. People with a lot of facial hair might not have the best fit with masks. And certainly within the hospital, we have to have certain types of masks. You might have heard these on the news before. These are called the N95 masks. These have a very snug fit around our mouths and nose. Again, this is not for use in the general community. These are mostly for use in hospital settings and healthcare settings. But certainly facial hair could impact that. However, in general, I wouldn't be too concerned about the virus being as a mode of transmission on people's hair. I think it would be extremely rare.
Thank you, as always, Dr. Bogoch. We appreciate your insight this morning. Thanks.
Anytime.
And if you have anything COVID-19 related you want answered, we'll be asking you for your questions on social media every day. So there you go. That's how you can hand in your questions to us. Hand in like it's homework.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.